a journalist with a long-standing interest in healthcare technology. And today I'm going to be talking to Lyn McCrae, who's asked me to describe him as founder, executive director, and Mr. Oddjob at Orion Health. And that absolutely doesn't really convey the breadth of his vision. Lyn's built Orion Health up from a company that, from its home base in New Zealand, that now works across the world. It has a presence in the Middle East, in the US, in Canada, and very much in the UK, where it's one of the major providers of shared care records and data services to the NHS. And we're going to be having a chat about some things that are going on in the NHS at the moment and where Lyn thinks that the technology needs to develop and needs to fit. So if we start with the NHS, from your international perspective, how do you think it's getting on at the moment?
Well, actually, firstly, for me, health was a little bit of an accident. I got a health project 35 years ago, and it was such an interesting, fascinating field. Here I am today, still in healthcare. And we have a very interesting perspective as a company in Orion, because we're all over the world. As you mentioned, we're in the Middle East, very strong presence there, Canada, US, New Zealand, Australia, and of course, the NHS. So we get to see a lot of the health reform programs that are going on around the world. To be fair, some of them are quite hard to understand.
We were discussing the number of acronyms.
I think there should be, we talk about standards, we should have a standards for the acronyms that you guys all use. Every country seems to have their different set of standards. And you've gone through a health reform here. New Zealand has gone through health reforms recently. I'm on record as saying how can I put it, we could have done much better. Looking at your health reforms here, the way you have the ICSs, clusterings of trusts, combining social services with healthcare services, that to me makes huge sense and is the future. And so therefore, if that is the future, then the question is, what IT systems do you need to support that type of healthcare?
And the reason you think that we're going in the right direction, at least, is because you strongly believe, don't you, that care needs to be much more joined up for the patient, and it needs to be much more joined up across the system.
So I think if you want to find out the problems in healthcare, the way to do it is to get a good a grade 3 or grade 4 cancer, which I had, by the way. By the way, it did actually have I think it's had a healthy outcome so far, or have an elderly patient that you need to look after. And, just navigating the healthcare system is very hard. It is not a good experience. And I had a good health outcome because I was surrounded, my family was hugely supportive. I tenaciously followed up all my appointments. I even have to give a few of my providers bottles of wine, and I did actually have the resources to procure any extra services that I needed. But that shouldn't be what you have to do to get good healthcare. It shouldn't be like that.
So what sort of IT do we need to make things better?
Well, the problem is, you've got to look at what the problem is. The problem is today, most developed countries have a patchwork quilt of providers. And the person who is ill has to navigate through all the different providers. So they need to be joined up. And so first of all, it's what a lot of the regions here are doing and other parts of the world, is you need to pull together the medical record so that all providers can see a common view of the patient's healthcare. We also need to look at the workflow in healthcare, and having a GP appointment as the first port of call for any healthcare condition is illogical. We're asking GPs to do things well beneath them, and so the first port of call clearly should be, a pharmacist can do, some people think, up to 70% of what a GP does. Care coordinators, nurses can do a lot of things that a GP can do. We need our professionals to be working at the top of their license. So therefore, if you're going to do this, you need to have quite good, so first of all, you need to have, first of all, the medical record pulled together. Then you need to have very good transfer workflow between all those different parties. And I personally believe, ideally, if they were working for a single organisation would be quite beneficial. But it would require some fairly significant changes.
And you have a concept, don't you, of the digital front door sitting on the front of this for the patient to go through?
Yes, we have historically had what they call patient engagement apps, which might show you your lab results, perhaps your scripts, and a few other bits and pieces, but generally they aren't very interesting and not very useful for the patient. Now, I've got one of those. The big next generation of those products are called digital front doors, and a digital front door is a bit like banking. So instead of just providing your bank account details, it will allow you to do a lot of banking-like services, but for healthcare. For example, you can have an online consultation. You get your device data integrated into your medical record. Sometimes symptom checking. But the interesting thing is, as soon as you get these very, very rich, lots of data in your medical record, the one little issue that occurs is there's too much data for humans to actually digest. So I am a latter-day convert to machine learning, chat GPT, that style of making suggestions to the physician. In the end of the day, the physician has to make, or the nurse has to make the final decision call. But I am simply amazed at how clever some of that stuff is. I have used it a little bit to write the odd article or two. just a starter, okay, not the end.
Just put us all over the job.
Just to kick off the article, not to write the whole thing, right? And that's very good.
I think one challenge we come up against, though, is we've heard a lot of these ideas over the years. You know, right back in 1998, we had an information for health strategy, we had NHS Direct, we've had shared care records for quite a long time, we've got lots of apps. Why is it so difficult to actually get this kind of reform to stick?
Well, you've asked a couple of questions there. I think one of the problems the tech sector, we have looked to use technology to change healthcare. Really, the changes to healthcare have to happen first, and technology is a supporting act. I mean, some vendors are out there suggesting that put in their multi-million-dollar system and it'll reprogram your hospital. It doesn't happen. And so I think, first of all, you've got to envision, and as I said before, the best way to look at what sort of healthcare services we need is to get a good health condition yourself. Get a good chronic condition, which requires you to visit multiple providers. And then you come to realize that most health systems are geared around the needs of providers. They're not geared around the needs of patients, unfortunately.
Okay, lovely. Thank you very much indeed.
I hope that was of interest.
Yeah, no, that's great. Thank you very much indeed, guys. And visit the Orion Health website. Have a look at everything we do.